So today I'm going to do an exam on this baby who is about 2 hours old. The first thing I'm going to do is to observe its overall appearance. And this baby is in a quiet, alert state. Her skin is warm to the touch. She is well flexed, as you can see from her limbs. She has good muscle tone and a beautiful, mostly pink color. She has a little bit of peripheral cyanosis in her hands and her feet, but no central cyanosis. And she also appears to be breathing just well right now, just fine. Okay, so I'm going to start the exam and I'm going to move from head to toe. So the first thing I'm going to look at on the baby's head is its size in relation to the rest of the body. Now, a normal newborn is going to have a head that appears somewhat large relative to its body. If the head appears somewhat small, this could be due to microcephaly. Now, this baby's head appears perfectly normal and it is beautifully symmetric. And now I'm going to feel the fontanelles. The anterior fontanelle is open and smooth, and the posterior fontanelle is as well. I'm also going to observe the head for any bruising or swelling in the presence of molding. And this baby has moderate degree of molding and just a bit of caput. Okay, so now I'm going to look at the face and get an overall picture of the symmetry of the face. And I'm going to look at the size and the position of the eyes, the nose, the ears, and the mouth in relationship to the whole face. And it appears nicely symmetric. Now I'm going to turn my attention to the baby's ears. And I'm going to look first at the position of the ears. Now, if I were to draw a line from the corner, a horizontal line from the corner of the baby's eye to the top of the baby's ear, that would show me that those ears are in the appropriate position, which they are. I'm also going to look at the formation of the helix and the crux. I'm going to observe for the presence of skin tags and pits, which can be signs of other congenital or genetic abnormalities, and I don't see any. Now I'm going to look at the baby's eyes, and I'm going to observe for their shape, their size, their symmetry, and the presence of any slanting, downward or upward slanting. With my pen light, I'm going to shine the light in the baby's eyes and elicit the red reflex, which is symmetrical. It appears in both eyes. I'm going to observe the cornea and the sclera, and they appear clear. And I'm going to look for the presence of any discharge in the baby's eyes. If I see any, we would want to take a swab of those to determine if the baby needed treatment for an infection, an eye infection. Now I'm going to look at the baby's nose, and the important thing about the baby's nose is to determine that the nares are patent. So I'm going to use my pediatric stethoscope, and I'm going to occlude one nair with a finger and listen for breath sounds in the other nair, through the other nair. And then I'm going to do the same thing with the other nair, and both nairs are patent. Now I'm going to observe the baby's mouth and the lips for symmetry and form, which they appear to be. And I'm going to use my gloved fingers and insert one finger inside of the baby's mouth to solicit the sucking reflex. And this baby has a nice vigorous suck. Now I'm going to move that finger along the hard palate all the way to the back and to the soft palate, which can stimulate the baby to gag a little bit. And what I'm looking for is the presence of any clefts in the palate, and there are none. Now I'm going to observe the baby's tongue for mobility, and I'm going to look for the presence of a tongue tie. And the baby's tongue appears free and mobile, and I don't see any evidence of a tongue tie. Now I'm going to look at the baby's neck, and I'm going to observe for any skin folds or webbing, and any swelling that might be present. Now I'm going to feel the clavicles to make sure that they are intact and there hasn't been a clavicle injury during birth, which can sometimes happen during a shoulder dystocia, and they are in fact intact. Now I'm going to observe the baby's chest, looking at its shape and its size and symmetry, symmetry and movement with respiration. And this baby's chest is nicely rounded. Movement with respiration is symmetrical. I'm going to look at the nipples and the areola for symmetry and placement. And now I'm going to use my stethoscope to listen to the baby's heart and lungs. I should hear heart tones loudest on the left side, but I'm going to listen in 4 places, and I'm going to count the heart rate for a full minute. This baby's heart rate is 140, and I do not hear any murmurs. Now I'm going to listen to the baby's lungs. And the lungs appear clear bilaterally. And I'm going to count the respirations for a full minute. And this baby is respirating at 50 times in a minute, which is also normal. Okay, now I'm looking at the abdomen, and I'm going to use my hands to softly press to feel for the presence of any masses. And it appears soft with no masses. Now I'm going to look at the umbilicus, and it is appropriately placed, and I don't see any evidence of an umbilical hernia. I'm going to observe the end of the umbilicus for the presence of 3 vessels, and I do see 2 arteries and a vein. And I'm going to use my stethoscope to listen for bowel sounds. Which I hear. Okay, so now I'm going to turn my attention to the genitals and to the anus. I'm first going to feel for the femoral pulses, and they are both palpable. I'm going to turn this baby over to observe the anus. And because this baby has not yet passed meconium, the anus appears patent, but we don't know that for absolute sure until the baby passes meconium. So we're going to say presumed patent at this point. Now, if this were a male baby, I would look at the shape and the size of the penis, the length and the shape of the penis, the position of the urethral meatus, which is appropriate, and I will feel the scrotum for the testes to ensure that they are both descended, which they are. Well, this is not a male baby. This is a female baby, and so for the female baby, I'm going to I'm just going to observe the labia, the clitoris, the urethra, and the vagina, and everything appears normal. Okay, so now I'm going to look at the extremities, and I'm going to first observe the arms and the hands. The arms are well flexed and appear to have good range of motion. We have 5 fingers on each hand, which is appropriate. And I'm going to look at the creases on the hands, and they appear normal as well. The legs also appear well flexed, with good mobility, and the right number of digits on the toes. Now I'm going to evaluate for hip dysplasia, and we're going to do that using 2 maneuvers. The Barlow maneuver first is going to involve flexing the baby at the hips and the knees and gently abducting the hip out to the side to listen for a clunk. I'm going to do that on both sides. Now the Ortolani maneuver, I'm going to do something similar, but I'm going to adduct all the way to the side to really evaluate the range of motion and whether or not I hear any clunks as that if there's a dislocated hip, if that moves back into place when I do that maneuver. This baby's hips have full range of motion and I did not hear any clunks. All right, now I'm going to turn the baby over to look at the spine. And this baby's spine is straight. And I don't see any dimples or hair tufts or odd pigmentations. Okay. The curvature is appropriate. So I'm going to turn the baby back over and just observe the skin color and for the presence of any rashes or marks or birthmarks. And I don't see any on this baby. Okay. Now to evaluate the baby's neurological well-being, I'm going to elicit a number of primitive reflexes. We've already tested the sucking reflex, so now I'm going to test the rooting reflex by stimulating the baby's cheek and watching to see the baby turn her head in the direction of that stimulation. That's the rooting reflex. Now the palmar grasp reflex, I'm going to place a finger in the baby's palm and watch as she curls her hands and grasps my finger. That's the palmar grasp reflex. Now the Moro, or the startle reflex, I'm going to elicit by holding the baby up and gently dropping the baby's head lower than the body and seeing that the baby shows a startle reflex with the arms out to the side. Now the Babinski reflex, I'm going to elicit by upward stroke on the baby's foot and observing for its toes to fan out. And lastly, the stepping reflex, I'm going to lift the baby up into an upright position and watch as its legs simulate walking or stepping. Okay. Now the last thing I'm going to do on this exam is measure the baby's length, and I'm going to do that with a measuring tape by measuring from crown to rump and then from rump to heels. And I'm going to weigh the baby using an appropriate scale. Okay, that's it.
Good.